So I was having a little look around to find this, and it's the book that I took with me to my visits. And I just jotted down a couple of things. And it was actually quite nice to, because I've just found it today, I was having a rummage, and it was nice to have a little flick through of actually. It brought back quite a lot of memories of the family. Yeah, it's lovely to read through it again. It was incredible that they would let us into their home and talk about something that might be quite difficult to talk about with strangers that they've only just met. And it was a great experience. I enjoyed it a lot.
The family that I got to see were a husband and wife, and the husband was the person with dementia. He had a mixed Alzheimer's and vascular dementia, and the wife was the main carer. And we were actually really lucky because we got to see the family within 3 or 4 weeks of the diagnosis. So over the 3 years, we got to follow them on their journey from like the start to when we finally said goodbye to them. And I think that was really interesting because we got to see how rampant or how everyone responded to the diagnosis, especially the carer. Because we asked her, what would you like us to say to people about dementia? And she said that the care is with them all the time, and we do struggle. And that still stays with me today, I think. Because even when I see patients that don't have dementia, I'll try and like, oh, hang on, how's this going to influence like the patient's family, not just the patient?
The lady I was with at the family, she quite liked poetry. And she wrote a poem about kind of her experience of, I guess, becoming a carer, if you want to use that word. And I wrote the first line of it because it stuck with me. Today I lost a part of you that was here yesterday. And that was the first visit. I forgot that was at the first visit, and I think that kind of shows you how they let us in. And that poem obviously was very personal. So I forgot that was at the first visit actually.
So when I first got the details about the family I was due to visit, my first impression was surprise at how much experience they had both personally and professionally with dementia. So one had previously acted as a care worker for dementia before retiring, and the other individual had also previously cared for someone with dementia. So they had a really significant amount of experience, which can be quite intimidating, I suppose, when you feel that you've got so little at the time. I didn't know much about dementia when I started, but I absolutely did by the time it had finished, because my family, not only did we have great conversations, but they gave me a file of patient information leaflets, information about the condition, advocacy groups, everything, and just handed me this file and let me borrow it for several months. So it sort of worked quite nicely to link that sort of personal element of dementia with the healthcare area of dementia and how those two can overlap and how you can sort of help each other in that situation.
One of my fondest memories was when like my partner took the carer into the kitchen and I stayed with the person without dementia, and I saw like a photo album. So we got the photo album out, and that was it. For the next hour he was just flicking through his life, like talking about how he was a milkman, showing us his daughters, and just talking through different experiences of his life. And I think that was really profound, because it showed that there's still a person there and they still have memories. It's just that they can't formulate them in the moment. That and just going to someone's home and speaking to a patient, it's reminded me that like you can do, like I'll learn the medicine eventually, but you really need to understand how to connect with a human being.
What struck me was he wasn't angry at all with the diagnosis. I mean, he said he had been in the past, and sometimes it had been quite tough on him and his partner. But he said that over the years they slowly kind of adapted, and it was just, he said it doesn't define me. I remember that, it doesn't define me. It's just something I have. I'm still me, kind of thing. and that was a nice moment actually.
I think you learn a different level of respect for people. It sounds very strange, but because you are so involved and you appreciate more and more the position they're coming from, I think you start to really admire them and really admire what they're up against on a daily basis, and those challenges they have to encounter day in and day out. So I think it does change the way you view patients as a whole, because I think it's quite easy to forget just what's going on outside of the hospital, but actually how important that is on someone's health, and in fact the health of a whole family.
I always remember leaving visits feeling just happier. It was just a nice environment. And again, it was, even though I suppose the reason of this is a learning opportunity as well, but it was also kind of good for the soul in a way. I will always remember them. I will always remember our family that we visited, because they were great human beings. They were lovely. Yeah.